Hi, my name is Gary Stocker. Like you, I'm a medical laboratory scientist. Unlike you, I am an old medical laboratory scientist. And as such, I want to share with you some guidance, tips, and tricks to best prepare for your first job search as you graduate from college. In this video, I will share some of the best practices in preparing your resume, interviewing virtually or face-to-face, and how to negotiate the best compensation offer from laboratories offering you a job. We know that in 2022, the market is tight for your new profession. There should be many opportunities for you, especially if you have the flexibility on where you want to live. So let's get started. It's easy to best view resumes as kind of your ticket for a conversation about a job, whether it's your first job as a medical laboratory scientist or somewhere down the road interviewing for a supervisory role, a management role, or even with a manufacturer of laboratory diagnostic equipment. A couple of tips to think about here, and the obvious one is one that too many people miss. This is an exact industry, an exact profession that you're entering, so precision and accuracy is important, so no typos. Have somebody else look at your resume to make sure everything in there is spelled correctly. Same thing with grammar. Make sure the grammar is absolutely perfect on your resume, even if somebody else has to check it. On the header, one tip that many people don't recognize is when you use your name, email address, and phone number, that's really all you need. I would encourage you not to include your snail mail address on the top of your resume. It can introduce bias to the person reviewing the resume based on location, zip code, all those kind of things. As a new med tech, I would include your education at the top, your Bachelor of Science or your Associate of Science, whatever it is, at the top of the resume to get the attention of the screener. Then I would put the work experience, things you've done particularly associated with healthcare, associated with laboratories, and then other jobs you've had as you've worked your way through high school and college. And then lastly, on the resume, there's really no need for references or compensation ranges. They're just not used anymore in the context of the resume, so just skip that altogether. So next, of course, is the interview. And we're going to talk about it both in the context of a virtual and a face-to-face interview. And you can see on the left-hand side, it doesn't matter whether it's virtual or face-to-face, dress the same. Collared shirt, not too many colors on the shirt, is usually the best. Make the lighting good. You can see on the video that I have now, I've got a lot of light in front of me. Don't worry about this too much. If you just got a decent overhead light in the room, that should be good enough. Just make sure that your face is not dark when you're doing that virtual interview. It creates a bad perception, and remember, you only get one chance to make a good first impression. And then something else to think about, especially if you have laptops or portable computers, is stay out of personal spaces when you're doing these interviews. Stay away from bedrooms, kitchens, etc. If you have to do it in your bedroom, make sure the bed is made and the background is not cluttered with clothes and junk and trash like that. Make the background as solid, clean as possible. And then lastly, keep the microphone close. And it varies per microphone, typically 6 to 10 inches, something like that. But in conjunction with that, earbuds are fine. If you have earbuds you want to use and the microphone piece is good, that will work just fine. Preferably those without cables, but if you have one with cables, that's fine. And then let's think about the face-to-face, because again, in our post-pandemic world, we now have the handshake decision. And whichever you're comfortable with, the fist bump or the traditional handshake, offer it up early. So as you walk into the hiring manager's office or meet them in the laboratory and you want a fist bump, don't wait till the last second. Get that fist out as you approach them so they know that's what you want, and you don't have folks doing this trying to decide whether you want a fist bump or a handshake. Same thing for a handshake. Just get that hand out early. Thumb up, good firm handshake when you get started. When you sit down, and I assume you'll be able to sit down for these interviews, have your list of questions prepared. Take out that list of questions. Have paper ready. Have some extra paper to write your notes on. And just show that you're organized. Show that you're ready. And then finally, when you get that face-to-face and you're in the room, have some planned small talk. It can always be the weather. If you had parking garage issues, as you see on the slide, you can say, hey, you have an interesting parking garage. Traffic was light, traffic was good, whatever. But have some plan And this is a list of typical interview questions, and you can see them on your own. And in each case, you're going to want to have thought about the questions and what your response may be. Why do you want to work here? List 2 or 3 reasons, have them down on your piece of paper. You don't have to read from the paper, but you want to have thought about them before. What did you like about your internship? What did you not like about your internship? Good interviewers will ask you about both good things and bad things. Be prepared for both. Why medical laboratory science? It's a fair question for a new professional. Why did you choose this career? Was it for patient care? Was it for the science part? Was it because you just were fascinated with laboratory testing? Have a response ready for that kind of question. What is your favorite clinical department? This is the first time where I can suggest you don't always have to answer the question as asked. You may have a favorite, but right out of college, probably the best overall response is, I'd really like to focus on being a generalist. I want to develop and refine the skills I've learned during my internship and during my college days, if possible. What shift you prefer? You can answer that. You can say whatever shift is available. I understand when I start. Evenings or nights are most likely. When can you start? Again, you don't have to answer the question specifically. Something along the lines of, I'm sure we can find a reasonable time frame in the coming weeks and months that will work for both of us. No need to give a specific date during that interview. And as you can see, as you read this list of questions, these are a little bit more challenging. And you'll again want to have looked at these in advance and thought through what kind of responses you would have given these questions being asked. And again, what makes you a better candidate? We all go through essentially the same college education, the same kind of internship, so in that regards, we're all the same. So what makes you different? Was it the way you learned to draw blood and interact with the patients? Was it your skills in organic chemistry or anatomy and physiology? Whatever it is, think about what makes you a better candidate and have that response ready. And again, the second one is a don't like or a negative. Tell me something you don't like about working in a medical laboratory. Again, have a response saying, I like everything is problematic because we all have different preferences. So an answer to a question like that would be, I've always enjoyed phlebotomy. I like talking with patients. Are best used on the bench. So given the opportunity, I would stay away from phlebotomy, or whatever your response might be. The next 2 questions on what other hospitals you're looking at and compensation you're looking for, neither of them needs to be answered directly from your perspective. If they're asking what other hospitals you're looking at, they have interest probably, and they're trying to see how aggressive they're going to need to be with their compensation offer. When you get that question, what other hospitals are you looking at? I'm looking at a few. I haven't quite refined the list down to finals yet, but I am looking at quite a few different hospitals. And another tip on answering these questions, once you've answered the question, and this is an important tip, shut up. Be quiet. You've answered the question. When we're nervous, we tend to run on and on and on. Answer the question, shut up. Patiently wait for the next question. Compensation, same thing. I understand hospital laboratories have a range of compensation offers. I'm sure when we get to that point, we'll find a compensation that will work for you and work for me. We're going to talk about the compensation negotiation skills here in a minute. And tell me about a problem. So again, we're human beings. We've all had interactions that haven't gone well with friends, colleagues, those kind of things. Tell me about a problem you've had with someone or with a worker. The only guidance I would give, if it's generic, don't do family members, don't do anybody you're in a relationship with. Focus on fellow workers, supervisors, maybe community events, those kind of things. And the last one is tell me another. And I put this down only because the really good interviewers know that you come in with answers ready to go. They know you have an answer ready for tell me about a supervisor you had a problem with. They may say, tell me another story about another supervisor you had problems with. So any of the questions on this page and the previous page that are useful for like this, be prepared to have at least one more story in your hip pocket. It doesn't happen much, but it does happen. So in all of the discussions I've had in coffee shops or via the internet or face-to-face in other settings, The compensation piece is always the toughest, and I'm going to give you a specific formula and some specific perspectives to look at. It's important to know that hiring managers have pay ranges. So do the recruiters, or sometimes called talent acquisition folks. And it looks something like the image in the bottom right-hand portion of the screen. They have levels, and it can be any number of levels from 3 to 30, and they have ranges inside these levels. And for example, in my simplistic example, you've got 3 levels here, and a new med tech is going to be at one of these levels, at a lower compensation level. Maybe if it's your second job, it's in a different category with a different compensation level, and the same for those who've been around for a long time and have been in the field for 10 or more years. Your challenge is to get from this level to this level, whatever that is in your organization. But it's also important to note that the person making that compensation offer has a chart, something similar to this that they're working from. You just want to impress them enough with all the stuff we've already talked about to have them more comfortable raising that level with which they can start your compensation for their organization. So here's the way it works. And you get a call or face-to-face, and the hiring manager says, Sally, we'd like to offer you a position at $30 an hour in our hospital. Memorize the response that I have here. Ask how much, I'll back up for a second. First of all, thank them for the offer. Thank you, ma'am, for the offer. I appreciate that. How much flexibility do you have with that? And stop. And you wait for the person to come back with another response. 2 basic things will happen. They'll say, I have no flexibility. It's hard to believe, and if such, that's probably not the type of organization you want to work for. And if they do, they're going to know the chart that they have, and they may have it in front of them, and they're going to adjust that compensation. Here's the way to look at it. A full-time person in any organization works 2,080 hours a year. 52 weeks times 40 hours a week. Do the math. I'm just going to use the number 2,000 to have it round up. If you can negotiate an additional $1 per hour off of the initial offer, that's an additional $2,000 per year in compensation. That's only the small part. If you're able to negotiate that higher rate, that becomes your base from that day forward. It's unlikely you would ever take a medical laboratory scientist or MLT position for compensation below that. And if you work, for example, for 40 years, if you can negotiate $1 or $2 or more per hour in that initial salary offering, you'll come out way, way, way ahead over the course of a 40-year career. And then the last item on this list is benefits. Everybody has them. They're not worthy in terms of negotiating for those. It's standard health care, standard life insurance, days off. They may be varied. Some organizations may have 15, some may have 18 or 20. If that's important to you, so be it. But typically, benefits are not a decision point for whether you'll go to work somewhere or not. The healthcare premiums tend to be different from one place to the other, so there can be some cost differences. But in the overall scheme of things, it's your compensation, what goes into your bank account, that you want to focus on the most. And then as we start to wrap this up, you want to have some questions for the recruiter or the hiring manager, whichever the case may be. And it's best to have those written down. So we talked about that piece of paper. Have the questions written down. They can be similar to the ones you're seeing on the screen, or they can be your own. But read down the list. Show that hiring manager you're prepared. What's the time frame for making a hiring decision? You want to know that for your own benefit. Most organizations in the tight market right now, they're going to make offers pretty quickly. If you're talking to a talent acquisition person, recruiter, or hiring manager, and they say it's going to be 4 to 6 weeks, I would view that as not a good thing, and you probably want to keep looking for other opportunities, especially if you have flexibility on where you want to live and where you want to work. And then these questions are for the hiring manager. They're slightly different from one to the other. For example, for the hiring manager, they're going to know what the orientation looks like. How long would you be on days learning how to work all the instruments for your rotation onto evenings? You want it to be a considerable period of time. Bare minimum would be a month, depending on how many departments you're going to be trained in. And sometimes it will go well beyond that. The more orientation and training you get, probably the better off you'll be in that first position. And you can see the other questions. Use them, don't use them, but have a list of questions ready to go. And then finally, the top tips. And as I have shared throughout this presentation, tell stories. You have a long list of stories associated with your internship, your college education, work experience you've had before. Be prepared to answer the questions asked by the recruiter or the hiring manager by telling them stories. And once you tell the story, stop talking. Let them ask the next question. Keep in mind, you don't have to answer the exact question. If they ask you how much compensation you're looking for, the response, as we talked about earlier, would be something along the lines of, I'm sure we'll find a rate that works for you and for me as we get to that point. And stop talking. And then finally, like we've said before, have your notes open and in front of you and have that pen or pencil ready so that you can show you're organized and be prepared to be more comfortable as you have that interview. If you'd like to contact me with more questions or to have a practice interview session, you can see my email at the bottom of the screen. Feel free to drop me a note and we can set up a brief one-on-one practice session. I also offer some regular sessions that are available, and I'll make sure that those have been included in the description down below. I wish you the best as you start your medical laboratory science career.